Hello, my name is Harold Stanley, and this is my informative speech. For my audience, I have Brad Jenkins and Jackson.
That's us.
I have Adam and Grace. This is my note card. Have you ever been on vacation and something tragic happened? This is a reality that happens to millions of Americans every year, each needing to seek medical care with their information maybe millions of miles or 100 miles away with their own healthcare provider. The invention of the electronic medical record has allowed many to seek that access and have that information available regardless of their provider and where that provider is at. The electronic medical record, although not new, started in the 1970s according to Healthcare Management magazine. This started actually with the U.S. government using it with the National Coast Guard and the U.S. Navy. Seeing how the benefits of the electronic medical record during the 1980s, according to the American Journal of Health, President Bush saw the need and invented or implemented the electronic medical record into the mainstream and private sector. The insurance companies saw the benefit of the electronic medical record. Access now became more clear, since legibility was always an issue with healthcare providers, and the access to the information sometimes was slow to beneficiaries. Now that information is relayed within moments and seconds to any provider, any access worldwide. And this is according to Scranton University. Although the electronic medical record is quite expensive, according to Health IT, the implementation of the electronic medical record can cost a facility anywhere between $100 million to $150 million for a single instance. Single-tary providers and individuals such as dentists, practitioners, and nursing homes can pay as much as up to $70,000 for a single instance of the electronic medical record. This does not include the individual cost to link those or to talk for the information to go between facilities and providers. However, the government, in order to help these providers and facilities out, incentivized for the electronic medical record to be implemented within these organizations within a certain period of time. If the electronic medical record, according to Health IT, was implemented in a facility by the year 2015 and they can meet the terms of meaningful use, which is a way that the organization is demonstrating they're using the information to better the health of the community, the public, and to meet core standards, therefore the government would subsidize and then give the organization incentive money that would offset the cost of the electronic medical records. However, on the other coin, many of the organizations could not meet these standards. Many did. However, those who can't, well, the electronic medical records will find that they'll be fined starting in the year 2017. These penalties could be up as much as 1, 2, 3%, up to 5% of Medicare healthcare reimbursement. These incentives and penalties is a driving factor to the use of the electronic medical record in today's society. Security has always been an aspect of the electronic medical record. The information obtained within the electronic medical record is downloaded on secure servers and is transmitted through secure transmissions. Patients are able to access their information through patient portals called MyChart Access. This is where the government has now allowed the patients to access their own records through a secure service. They can get online. You put in your username, your password that's given to you by the organization, and then you're allowed to receive certain parts of the electronic medical record. This invention and this use of the electronic medical record has now created a society to where individuals such as yourself, your family, and each and every healthcare worker allows that individual to become part of the healthcare team. The electronic medical record has changed the future of the communication between the patient and the physician, hospital to hospital, physician to physician. Throughout society, there may be nothing else that has changed it more than this. Again, my name is Patrick Stanley, and this is my informative speech.